Hi friends, I'm here to share with you 5 tips to make your pump sessions not suck so much. Somewhere along your breastfeeding journey, you may find that you'll be needing to use your breast pump. Whether you're pumping exclusively, going back to work, or just pumping every so often when you have an appointment, we want to make your pump sessions as efficient and as effective as possible. Tip number 1 is make sure your flanges fit you properly. Keep in mind your flange fit has nothing to do with your breast size and everything to do with your nipple size. When you get your pump, it'll usually come with 2 sets of flanges. Usually they're in the 21 to 25 millimeter range, which is kind of in the middle as far as sizing goes. When you use your flange, if you find that your nipple is getting pinched, your flanges are probably too small. If you find that your areola is getting drawn in, it's probably too big. If the flanges you get when you buy your pump don't fit properly, please know that almost every pump manufacturer provides a range of sizes on their website. They usually also have some information on getting the right size. If for some reason on the website for your manufacturer you cannot find the proper size, please know that there are also other brands that make compatible products. Maymom is a really reliable brand in my experience. They're available on Amazon and have a full range of pump parts for every major pump on the market. Another really awesome brand that I found that I like is Pumpin' Pals. They've got these flanges that are set at an angle, which means you get to lean back into your chair and relax. Their smaller flanges also are silicone, which is really good if you have elastic nipples. Keep that in mind if that's something you have a problem with. Tip number 2 is to check your pump parts. Your pump can be run anytime from 8 to 12 times a day, depending on if you're pumping exclusively, and having your parts in good repair can really make a big difference. There's 3 places on your pump you'll want to be checking often. Some of these parts may need to be replaced as often as every 2 weeks. Some you might have to replace for 6 to 12 months. You'll just need to check and see how yours are wearing. Place number 1 you'll need to check is your valves. They'll be located somewhere in here in the bottom of your pump part, and these ones are duckbill valves, but there's another style that has a hard plastic base and a soft silicone flap. Any rips, tears, or wearing on these will make your pump very ineffective. You'll need to check these. These also wear out the fastest because they're getting used the most, and they are more likely to get damaged when you're washing them. Part number 2 you need to check is your diaphragm. If you have a closed system pump, and most of the major pumps on the market now are, you'll need to check your diaphragm. This is a Spectra pump. It's located inside here. This part here is prone to wear and tear after a while. It's where the pump draws in and gets its suction from. Check these here, make sure there's no holes. You'll also want to check these when you're washing to make sure you don't have any condensation building up in here, because if you do, you can end up with mold. That'll contaminate your milk, and we don't want that. Place number 3 to check is your pump tubing. Whether it's silicone or the harder vinyl tubes, you'll want to check these frequently for holes, especially if you have small animals, kids, even big animals. These are prone to getting chewed on. Keep an eye on those. Tip number 3 is a pumping bra. This can really help because you'll have your hands free to do other things, whether it's working, driving, relaxing, or just tip number 4. We'll get to that. Most pump bras on the market are a similar style to this one. There are others, but this is a Simple Wishes one from a brand called Lancino. It zips up in the front. It has an expander available for the front, and it also has a Velcro panel to expand the size in the back. Wrap it around your body, zip it up, and your pump parts go inside these holes here. They hold them close to the chest and provide a little bit of pressure, which can be helpful. Other than that, my favorite tip for a pumping bra is to use your existing nursing bras. I like this because you don't have to buy anything else, and if you're nursing baby, you typically already have bras like these. To do this, you'll want to take your bra, unclip it just as if you were to nurse baby, and fold the flap down. Take your pump flange, move this strap across the breast, center this, and allow this strap to provide some more tension against the flange. You'll want to take the bottom of your bra flap and bring it up here. Notice I'm twisting it. This would be to pull it directly up and it won't work as well. Twist it and you'll put this clip on backwards. This will provide support on the bottom and the side, and it's not bulletproof, but it can make your pump stay and put just fine. When you're doing this, it will leave you open to tip number 4, which is hands-on pumping or massaging the breast as you pump. From here, you'll want to keep in mind that your Milk glands can go from your armpit to the center of your chest all the way up to your collarbone. So you want to massage all these parts of your breast to ensure you're emptying yourself fully, getting all that milk out, and preventing any clogs. My favorite way to do this is to start at the back and use firm but gentle pressure to move the milk physically from the back of the breast to the nipple. You'll move all the way around, including the bottom and around to the middle. From the top, you'll go from the neck down to the nipple. I find it's most effective during a letdown, but you can also do some lighter, gentler massage when you're trying to get another letdown to start. Another way to do this and empty the breast is to take your flange and point it in different directions. So steer it almost like a compass. So you go to the center, to the outside, up and down. This can help to empty some of those deeper milk ducts that are harder to get to. My next tip to make your pump session shorter and more effective is to stop washing your parts. Now keep in mind this is only something that should apply to you if you have a healthy full-term baby. If you have a baby with special needs or a compromised immune system, please follow the suggestion of your pediatrician. If you have a healthy full-term baby, there is no need for you to wash your pump parts every time, and this can be a huge time suck. So not washing them can make your day go so much faster. So when to do that, you would take your bottles off, whether you pour into bottles or just cap the milk, stick that in the fridge. Take the rest of your pump parts, stick them in a clean, dry Ziploc bag or a reusable wet bag, zip that shut, and chuck the whole bag into the fridge with your pump parts. When you're ready to pump again, take them out, use them again, and then you can wash your parts when you get home or just once at the end of the day. Those safe in the fridge for about 12 hours. You could probably go longer, but I like to wash my pump parts at least once a day. Tip number, I lost count. You might get a bonus at this point. Have a photo or a video of your baby. If you're breastfeeding your baby as well, take a video of baby nursing at the breast. My favorite way to do that is at this angle right here. That way you get a picture of baby physically at the breast from the angle you see baby at, and you can hold it between you and the pump. Then you're seeing baby, not the pump. That can really trick your mind into getting more, faster, and better letdowns. You know what? I have one more for you. This won't make it more efficient, but if you're having anxiety about the amount you're pumping during a pump session, trying not to think about it can be hard. Watching only a couple drops or only an ounce or two when you know that you need more than that can be eased by doing this. Take a baby sock and cover up your bottle. There is no need to sit here and stare at every drop coming out of your pump. Instead, put the sock on, put one on each side, put the video on, watch a show, play a game, set a timer, come back and look at your pump, take it off. You'll likely be surprised at how much ends up in that bottle because you're not stressing and getting anxious about watching your letdowns. I really hope these tips help you have a more efficient and a more effective pumping session. Take care. Bye.